there, welcome back to Studying with Stephanie. Today we are continuing in the OCS, so the Orthopaedic Clinical Specialist Exam, and we are going to talk about red flags. Now, this is one of the first things that we're going to go over when it comes to the OCS exam, because it is so important as a healthcare provider, as someone who has direct access. So patients can come to me before they've seen anyone else when it comes to their injuries. It is important as a physical therapist to know when something is within your frame of practice or your scope of practice, or know when we need to use our interdisciplinary teammates, such as medical doctors, physicians, assistants, orthopedic surgeons, neurologists, and all of the other disciplines in order to create the best outcome for our patients. When we are talking about red flags, our main goal is safety for our patients. Safety for our patients is always what we are trying to provide. We want to get our patients better, but we have to keep them safe in that regard. So when it comes to red flags, there's a couple things that we need to be aware of when we are taking the history of a patient in order to give them the best advice on what to do next. So let's talk about it. So the first red flag we're going to talk about is unexplained fever, chills, or night sweats. As a physical therapist, we should not be dealing with any acute type of flu, any type of symptoms where there can be a fever or chills or night sweats, because there's obviously something going on that's more of an immune issue, whether it's autoimmune, whether it's a malignancy, or whether it is an infection. We should not be treating that. So if someone comes to you and they have an unexplained fever, chills, again, it's not chills because, oh, a draft walked by me, or ooh, I got chills because you said something. It's unexplained chills that are happening frequently. And again, night sweats. Night sweats is something that, again, it's not this, it's just hot in here. I woke up last night and I was sweating. It's unexplained. So these are patients that are telling you, yeah, I wake up in the middle of the night and I got to change my clothes because my clothes are drenched. That is something where you have to refer them to their physician. When we talk about red flags and referrals, we're not always going to create this catastrophizing event where we got to call an ambulance and get them to the ER or the hospital right away. Sometimes red flags are just an indicator that this is something that we can't treat as a physical therapist, and we need our team members to help us out. So I can say, hey, you have a fever, or you're having chills or night sweats. I need you to go to your physician because I need them to do a full workup, and that includes labs, and that includes potentially imaging, whatever the physician feels is appropriate. They need to clear you before I can actually treat you for the injury or the potential musculoskeletal impairment. The next thing we're going to talk about is profound and sudden onset of fatigue or malaise. This is just someone who's generally just looking unwell. They just are continuously and constantly fatigued. They really can't do much throughout the day. Again, this is something that is underlying in the patient's condition that is not normal. It is not normal. We know when you're working out, you may get fatigued, you might get tired, but you recover. So patients that aren't recovering from that fatigue, again, need further workup. Then we're going to talk about unexplained weight loss or gain. As a physical therapist, you're going to have patients that are coming in saying, oh yeah, I gained 10 pounds after my surgery, or yeah, I lost 5 pounds, but I haven't been eating and I haven't been, exercising, so it's probably muscle mass, those kinds of things. Unexplained weight loss or gain. Now, this is going to tell us there's potentially an endocrine disorder, so something like hypothyroidism, hyperthyroidism. It could be something like congestive heart failure, where they're just retaining a lot of liquid and fluid. And it could be something like, again, a malignancy. We don't know. We have to refer them out because our treatment is not going to change that. And we need them to get cleared and checked out, thoroughly examined before we can take them back to actually work on any potential musculoskeletal disorder. A lot of the times with these red flags, that might be the source of the issue that they're coming to us with physical therapy, right? So I can do all the physical therapy in the world, but if I'm not addressing the source of the issue, they're not going to get better. So that is another thing. If you're treating a patient, maybe they have seen the doctor, but they haven't seen them in a while, and they're just not getting better. They're not progressing how you expect them to progress for whatever you may have diagnosed them with. You got to send them back to the physician, because there is something indicating that their body isn't healing and progressing properly. When they go to the doctor and they get proper treatment for whatever that issue may be, the issues that they were coming to you for may resolve. So a lot of the times when we're talking to our patients about these potential red flags, why can't you just treat my shoulder? It's my shoulder that's hurting. Well, your shoulder pain can actually be from some of your organs. Our organs have similar nerve connections, and they can refer pain out to different areas of our body. You're also presenting with some things that are a little bit out of my scope of practice that I need a physician to look at so that we can give you the best care. If your shoulder is still bothering you after your physician goes over the potential other things that may be going on, I'll be happy to take you back. I just need those things cleared up in order for us to get the best effect out of our physical therapy. All right, so that's how you deal with something like that. So we also have unexplained nausea or vomiting. Nope, this is not something you see as a physical therapist. You don't treat random vomiting unexplained. Now, if someone says, oh yeah, my stomach's been upset from last night after I ate something, it's something you can proceed with caution. But again, they shouldn't be in the clinic. You may need to refer them out to the emergency room, urgent care, or their physician, depending on the severity and depending on what they're telling you with that. All right, now we're gonna go into a little bit more of the neurological things that can be red flags. So if a patient comes in and they have sudden paresthesia or weakness, paraplegia, quadriplegia, anything like that, that there's no injury indicating, or anything in general where they have complete numbness or loss of function of a body part, specifically if it's one-sided, if it's all limbs, they need to be referred out immediately to urgent care, to the ER, because they could be potentially having a stroke or some sort of neurological involvement. With that being said, bowel or bladder dysfunction. Our nerves control our bowel and bladder function. So if we cannot control our urination, specifically with sitting down because there's more pressure, if we're having also saddle anesthesia, so that area, like you always tell your patient, is the area where you would sit on a horse, numb or tingling, anything like that. That area in the rectal, down the superior posterior thighs is going to be indicative of a potential cauda equina. This person needs to go to the ER immediately. They need spinal decompression, anything like that, where they can't control their bowel or bladder and they're having that numbness and tingling in that saddle region. That is an emergency situation. Again, no need to heighten the patient's fear, but you need to tell them, hey, this is unfortunately not a situation that we can take care of in the clinic today, and I need you to go to the hospital immediately because we want you to be able to preserve your function of your bowel and bladder as well as your lower legs. Your nervous system can be getting compressed, and I need you to get that checked out at the hospital, okay? They should not be driving to the hospital themselves. Of course, if they don't have anyone with them, there's no one that you can get over to take them to the hospital, then it's an ambulance that will need to take them. But if there is someone with them that can drive them, they can, as long as they go to the ER right away and you stress the urgency, then that is fine. Okay, another thing is loss of coordination and balance. Now, this isn't someone who just kind of trips or someone who sprained their ankle and now is a little bit wobbly. This is someone with visible ataxia, visible impairments in their fine motor skills, in their actual function of their balance and their coordination. You see them trying to reach for something, they completely lose balance, they completely lose coordination of that motion. Their movement patterns look really off, really weird. And it's something that you're like, there's a lot going on here. Again, that they need to be referred out to their physician. And lastly, we have severe pain with weakness. Now, we treat pain and weakness day in and day out as physical therapists. The important thing here is, again, if we are a direct access physical therapist, if we are the first person this patient is coming to see and they say, I literally can't move my arm, it hurts so bad, we need them to go get some further workup, whether that's diagnostic imaging, whether that's a consult with a neurologist. There's something going on, and we very well may see this patient in a week or two after, or they may need surgery and then we see them after. But we need the doctor to be able to order those exams, take a look at them before we can proceed with physical therapy. Because again, if it's a complete rupture, if it's a neurological deficit, we cannot treat that right away, and we need to be a part of the rehabilitation program. So they need to get that initial treatment from the medical staff first before we can treat them as physical therapists. All right, so red flags, again, are so important. They are not the end all be all. We need to use our clinical judgment, and we need to take into account the entire history that this patient is giving to us. When we are coming across something like a red flag, we need to inquire more, ask more questions. If it is something that is not an emergency situation, like you suspect someone's having a heart attack, someone's having a stroke, those are very clear things that we need to call the ambulance for. But if it is something where the patient's functioning fairly well, they can communicate, we need to dive in, ask more questions, get a thorough history. A really good history is going to be one of your best tools as a physical therapist and as an orthopedic specialist, and it's going to guide your exam. So always rule out those red flags first. Even if the patient doesn't come to you and say, oh, I have a fever, ask those questions. If you're suspecting anything that's out of the norm, ask the questions, dive a little deeper, get a little bit more detective work on so that you can really give these patients safe and effective care. A big thing about red flags as well is we want to make sure that we're not falling into confirmation bias, that when we're taking a history, we're not just saying, all right, yeah, this is rotator cuff for sure, no problem. And then we go and we do an exam and it's not presenting as a rotator cuff, but hey, well, they have shoulder pain and it's a little bit weak on their external rotators and they're getting pain at the top of the shoulder. So that's for sure a rotator cuff tear. We need to really, again, like I said, fixate, ask a little bit more questions, get into that detective work to clear it up for your patient and for yourself so that you can really guide your program. We have yellow flags as well. Yellow flags are more of, I'm going to proceed with caution. I may need to bring in other team members in order to help with this kind of situation. These are things like psychosocial factors. So fear avoidance behaviors, depression, anxiety, any type of distress. I've had patients that were recently homeless, and that kind of distress, again, is going to affect their healing. It's going to affect, well, now you're homeless. You don't know what you're eating, when you're going to eat. What are you sleeping on? Are you even getting sleep? Are you not? All of those things, I may have to refer this person to a social worker. I may have to refer them to a psychologist, someone who's going to help in order to get that patient that holistic approach. So the yellow flags are things that we can continue treating this patient, but we may need to bring in other resources in order to get them the best care. All right. So at the end of the day, it's all about getting these patients the best care. When you are taking the OCS exam, it's really important to focus on these things when you're reading case scenarios. Look for any red flags that may be hiding in that case. Look at the patient's age. Is it bilateral joint pain? Is it multiple joints? Things like that could indicate there's something systemic going on, maybe rheumatoid arthritis, maybe a autoimmune disorder, something that's going on that we may say, I could treat this, but I think that you should get checked out first. That's always what we're looking for. So when you're taking the exam, really dive into that case study, underline, write down whatever are the important factors. So age, chronicity, how are the onset of symptoms? Did they just come on suddenly? Is it gradually worsening? Is there an actual reason that this person is having the pain? Is there a mechanism of injury, or was it just random? Does the pain go away at all? Does the pain change with movement? Does the pain change with rest? Anything like that. We need to look at all of those little tiny details, just like we would when we're taking the history of a patient. Again, because we want to provide them the best care possible. So that is the goal. I hope that this video helped you. If you've come across any red flags that are unique to your situation, something that you maybe wouldn't have expected, something that you are proud of yourself for referring out, drop it in the comments below. I'd love to hear your stories and I would love to learn from you. So if there's anything I'm missing, anything you want to add, let me know. And I hope you come back to Studying with Stephanie as we go on our journey through the orthopedic clinical exam studying. And I can't wait to pass this test in March. I hope you have a great day. Bye.